Nicole, ready for me? I'm taking over for Mr. G in room 304.
I guess so. This night has been horrible. Worst night ever. Mr. G, he's the biggest pain in my butt. Like, good luck, you're gonna need it. But I guess you want an S bar?
Yeah, we probably should.
So Mr. G is a 45-year-old man in room 304. Post-op emergent appendectomy happened yesterday. Today, or last night, he has been appearing agitated, claiming he's in severe pain, and he's been screaming at the nurses nonstop that we're incompetent. He also has a history of polysubstance abuse. I think that's really important for you to know. So his vitals, his heart rate's at 115 beats per minute, his blood pressure is 135/90, his respiratory rate is 17 breaths per minute, and his pulse ox is 95% on room air. He seems pretty fine to me, but he states his pain is 10 out of 10. I think he's just drug seeking. Can you please reevaluate him? I don't really think we should give him more medication.
Well, he just had an appendectomy yesterday. Is his pain not controlled?
It's not even about that. He has a history of polysubstance abuse. It's never enough for them. I gave him a scheduled dose of Dilaudid right on time at 5 a.m., but he claims it did absolutely nothing. He even threatened to sue me and the rest of the hospital.
Wow, that's rough.
I literally told him we are doing everything we can for his pain. He just needs to be patient. Anyway, he's your problem now. He's been quiet for the last hour, probably plotting what he's going to do next.
Good morning, Mr. G. I'm Laura, your nurse for the day. How are you feeling?
How am I feeling? I feel like I'm being tortured while you all stand around here and collect a paycheck.
I'm so sorry you feel that way. I just got the report from Nicole. Don't worry, we're going to get all this sorted out and make you more comfortable.
Don't worry. That's easy for you to say. You're not the one with a fire burn in your gut. Your night nurse was just as useless. She told me if I were you, I would try some deep breathing. I will show you some deep breathing when I shoot this whole hospital into the ground.
Hi, it's me, Sarah. I'm the charge nurse on the unit. I just heard some shouting, just wanted to check in, see how things were going. Oh, I can see that you were very upset, Mr. G. Sarah and I would like to sit, or Laura and I would like to sit with you for a moment. Is that okay? Can we come talk to you, or do you need some space and time?
Yeah, that's okay.
Okay. Just gonna pull up a chair, okay? Now, Mr. G, I also have gone over your chart, and I saw that you were in some pain and you just did have a surgery, is that correct?
Yes.
Okay, and can you kind of describe the pain for me today?
It is very sharp. It's a stabbing pain right here. It's not a dull ache. It is very sharp. It is being like 9 or 10 all night.
Okay, and did you get any pain meds? I saw that we gave you some Dilaudid. Do you think that made any difference, or no?
No, that wasn't enough. I needed more.
Okay, for sure. And did we do anything to help outside of the Dilaudid for pain?
No, you were all just sitting here useless.
Okay, I apologize for that. We will definitely do something, try to figure out a different solution, and maybe we need to change some meds or our pain management. Does that sound like a good idea to you?
If you say so.
Is there anything else that you would like us to do?
No.
No? Okay. So we're gonna get on the call with the surgical team. They'll come down, look at everything, make sure everything is good, nothing's infected, and then we'll do a different round of pain management, okay?
Okay.
Do you wanna do anything else?
No, you can leave.
Okay, sounds good. Here is the call light on the side over here if you need anything. We'll be back in a moment once we get done talking to the surgical team, okay? And we'll give you an update on everything.
Okay.
Okay.
Close my curtain.
Right on. Surgical team, a quick call. Let me see. They're okay. Number Bring, bring, bring.
This is Dr. Leroy.
Hi, Dr. Leroy. This is Sarah, the charge nurse in the ICU. I'm here to talk to you about Mr. G in room 304. He had
Okay.
a post-appendectomy last night, and he is in a lot of pain. I was wondering if you want to come take a look. He says his pain is pretty sharp. It's not dull at all, and it is in the surgical site that you guys are operating in. So if you want to come take a look.
Absolutely. Did you notice anything coming out of the wound?
Well, he was very agitated and didn't really want us close by. So we haven't taken a look, but we will happily take a look with you. I just don't think it's safe for us to go in just as nurses if you don't. I don't think he'll be too happy if we come in just as nurses if we don't have the surgical team with us looking at it.
Got it. What was his last dose of pain medication?
It was last night. He had some Dilaudid and he claimed there was no relief from the pain. He is a polysubstance user, so he does have a higher pain tolerance than most, but I think there are a lot of things we can do to help with that.
Okay, noted. Thank you. I'll be right down.
Okay, sounds good. Bye-bye.
Right. Knock, knock. Hello, Mr. G. How's it going?
Not great.
I'm really sorry to hear that. Our nurses were telling me you're in a bit of pain.
Yes.
Can you tell me more about that?
You can see that I have no pillow here.
Oh no, I did notice that. Would you mind grabbing us an extra pillow?
Of course.
Do you need anything else?
No.
Awesome. All right, we got a
All
nice
right, Mr.
fluffy
D,
one.
I got a nice fluffy pillow for you. Would you mind laying back for us, getting in the bed nice and comfy?
No.
Do you need help or anything?
No. I want you all to leave.
We can't do that, Mr. G. You're in pain, and we have to make sure that you leave our hospital in a better state that you came in.
Okay.
Can we have you lay down?
Yes.
All right.
So, Mr. D, I was telling Dr. Leroy that you're still having a lot of sharp pain in that incision site. So, do you mind if we take a look at it?
No.
Okay, I'm gonna lay you down, okay?
No.
You don't wanna lay down?
We've got to do a quick exam. Okay, we have to determine if there's anything else going on that's unexpected that we can take care of that will help decrease your pain. Does that sound okay?
Okay.
Okay.
Great.
I'm gonna lower you down, okay?
Okay. That's enough.
We have to go all the way. I'm so
All
sorry.
the
Is
way
that okay?
Okay, good.
We're all the way down. No worries. Almost done. Almost done. You're doing great.
Thank you, Mr. G.
And we are down. Thank you, Mr. G.
Perfect. All right, I'm gonna have to take a look at the incision site. Do you mind if I take a look?
How will you come back?
How about I come back?
Yeah.
Are you in pain?
Yes.
Okay. So the only way for us to take care of your pain is to get a closer look at what's going on.
Okay.
Okay? Can I have you lift up your shirt a little bit?
Okay.
Great, thank you. Well, Mr. G, there's definitely some signs of inflammation and possibly an infection. So I think we should probably run a course of antibiotics.
Okay.
Yep.
Okay.
And we'll get you some more pain medication, okay?
Okay.
Great.
Can you put me back up?
Absolutely. Does that sound like a good plan?
Yes.
Is there anything else we can do for you today?
How about you all leave?
Sounds good. I'll be out of your hair right now. It's
Okay.
nice to meet you.
All right, thank you. Close my curtain.
You got it.
All right, Mr. G, I'm gonna go grab those pain meds, okay?
Okay.
All right. All right. Hi, Laura. How are you feeling after the Mr. G incident?
Well, I'm glad that we decided to listen to him and get him further evaluated by the surgeon, because I just got his labs back and his white count is really elevated, so he does have an infection. And if we wouldn't have evaluated him, we might have missed it and let it fester longer.
Mm-hmm. Did the night nurse tell you anything about Mr. G prior? Did she do any looking into his chart, do any sort of therapeutic things for him?
She just told me that he was a polysubstance user and that he had had an appendectomy yesterday and that she had given him some Dilaudid this morning, but that he was still in pain, rating it 10 out of 10. But she didn't mention doing any other like non-pharmacologic actions to alleviate his pain
Okay.
or anything else.
Yeah, so we definitely should I love the way that you called me in and we looked over that and called the surgical team, had them come down, because you were right. Like, we did need to look at his lab count and everything like that. So I'm glad we took an extra look at it. And I think it is very important to, even though he had a history of substance abuse, that we did take his pain into consideration, and it did in the end show that he was having a super bad infection. So I think that's really good, and I think it was great that you came into it with a very unbiased approach.
Thank you.
Of course. All right, keep going at it.